Ever thought of pregnancy as a risky time for women? Though we often talk about it as a happy and exciting time, there are hidden dangers that could harm both the mom and the baby. Things like high blood pressure, diabetes during pregnancy, or serious conditions like a pregnancy that happens outside the womb or heavy bleeding can make the road to becoming a mom quite dangerous. The act of giving birth is not without its dangers either, with early labor and the risk of severe infections. Plus, we shouldn't forget about the mental health problems that can come up or get worse during this important time. But don't worry, with the right knowledge and care, these risks can be handled well. So keep watching as we reveal the 10 reasons why pregnancy can be a risky journey. Starting our countdown at number 10, the silent killer. This condition is like a wolf in sheep's clothing, often showing up unannounced after the 20th week of pregnancy. It's characterized by high blood pressure and can escalate rapidly, posing significant risks to both mother and baby if left untreated. The symptoms can be as subtle as a severe headache or changes in vision, making it easy to overlook. The danger of this condition lies not only in its silent nature, but also in the severe complications it can trigger. It can lead to liver or kidney failure and future cardiovascular issues for the mother, and premature birth or low birth weight for the baby. In severe instances, it can result in life-threatening conditions such as eclampsia and HELLP syndrome. But don't let this fear loom over you. Knowledge is power. Regular prenatal checkups are crucial for early detection and management of this condition. With the right care, this silent killer can be tamed. The key to managing it lies in regular prenatal checkups. Coming in at number 9, the sweet danger. This is a condition develops during pregnancy, typically around the 24th to 28th week. It's a scenario where the body can't produce enough insulin to regulate blood sugar levels, resulting in high blood sugar. This can cause complications for both mother and baby. For the mother, it increases the risk of high blood pressure, preeclampsia, and the necessity for a cesarean section. For the baby, it can lead to macrosomia, a condition where the baby grows too large, increasing the risk of complications during delivery. But it doesn't end there. This condition also raises the risk of the mother developing type 2 diabetes later in life. And for the baby, it increases the likelihood of becoming overweight and developing type 2 diabetes as they grow up. However, it's not all doom and gloom. Maintaining a balanced diet, regular exercise, and proper prenatal care can help manage this condition and ensure a healthy pregnancy. So, it's crucial to stay active, eat healthily, and keep those prenatal appointments. Remember, a balanced diet and regular exercise can help manage this condition. Coming in at number 8, the outlier. This is a rare yet potentially serious complication where a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This unusual placement can't support the growth of an embryo and poses a significant risk to the mother. If the fallopian tube ruptures, it can lead to severe internal bleeding, a circumstance that is life-threatening. Early detection is crucial for managing this condition. Signs of this complication can be subtle, often mimicking those of a normal pregnancy or even a miscarriage. They may include abdominal pain, light vaginal bleeding, and gastrointestinal symptoms. However, severe pain, heavy bleeding, fainting, and shock are alarming signs of a potentially ruptured situation. Remember, this is a medical emergency. If you or someone you know ever experience these symptoms, seek immediate medical attention. This condition is not to be taken lightly. Immediate medical attention can be a lifesaver in such situations. Number 7 on our list is the early arrival. This refers when labor begins before the 37th week of pregnancy. It's that can lead to premature birth, which carries its own set of risks and potential health problems for the baby. Babies who arrive early in the world may face respiratory issues, developmental delays, and vision problems. These complications can be severe, affecting the child's growth and development. This underscores the importance of regular prenatal care, which allows healthcare providers to monitor the mother and baby closely. This careful monitoring can help anticipate and manage these early arrivals, ensuring the best possible outcomes for both mother and baby. Careful monitoring of the pregnancy can help anticipate and manage such situations. Coming in at number 6, the unexpected bleed. This is a condition that involves heavy bleeding during pregnancy, childbirth, or even after delivery. It's important to note that this is not just a regular nosebleed. No, this is leading cause of maternal mortality worldwide. It also has a knack for surprising us, often occurring without warning. Like in the night, it can steal away the joy of what should be a beautiful time. But fear not, prompt and immediate medical attention can be a game changer. It can turn the tide, transforming a potentially deadly situation into a manageable one. Just remember, in the face of this condition, time is of the essence. Swift action is crucial in dealing with this complication. At number 5, we have the hidden threat. Pregnancy brings about a host of changes in the body, making expecting mothers more susceptible to certain infections. These include urinary tract infections, which, if left untreated, can escalate to more severe kidney infections. Other infections, such as listeriosis, pose a more sinister threat. Contracting listeriosis during pregnancy can lead to miscarriage, stillbirth, or severe health problems for the newborn. These infections might seem common, but their potential impact on both mother and baby during pregnancy can be significant. However, there is a silver lining. With regular health checks, these infections can be detected early. Treatment can then be administered promptly, mitigating the risks they pose. So remember, regular prenatal care is not just about monitoring the baby's growth, it's also about safeguarding the mother's health. Health checks can help detect and treat these infections promptly. Next in our lineup is a condition that generally goes unnoticed: the obstacle. This condition arises when the placenta, the essential organ that nourishes your baby, covers the cervix. This isn't just a minor inconvenience, it's a serious medical issue. It can cause severe bleeding during pregnancy and delivery, putting both mother and baby at serious risk. In some instances, it may necessitate a cesarean delivery, a surgical procedure that can be daunting for many. However, there's no for unnecessary worry. With advancements in modern medicine, this condition can be spotted early through routine ultrasound. Early detection enables close monitoring and planning, ensuring the safety of both mother and child. Therefore, remember, regular checkups are your primary defense. Regular ultrasound scans can aid in early detection of this condition. Coming up next, the silent block. Now, this is a term that might sound unfamiliar to many, but it represents a condition that can be of serious concern during pregnancy. This condition involves the formation of blood clots in the deep veins, typically in the legs. During pregnancy, the risk of developing these clots increases due to changes in blood composition and flow. But why should we worry about these clots? Well, the real danger lies in the potential for these clots to travel. If a clot dislodges and makes its way to the lungs, it can lead to a condition called pulmonary embolism, which can be potentially fatal. However, awareness is the first step to prevention and safety. By understanding the symptoms such as swelling, pain, tenderness, and redness in the leg, you can seek timely medical help. Treatment options are available to manage and dissolve these clots, preventing further complications. So remember, the silent block is a reality of pregnancy that needs our attention. Awareness and prompt action can prevent serious consequences. At number 2, we have the ticking time bomb. Pregnancy is a beautiful journey, but it's also a test of endurance for the heart and circulatory system. The body needs to pump more blood to nourish the developing baby, which puts additional strain on a woman's heart. This can lead to various heart-related issues, even for those who were previously healthy. For women with pre-existing heart conditions, the stakes are even higher. Their heart's already working overtime, and pregnancy can exacerbate these conditions, making it a potentially dangerous period. It's not just about the immediate risk either. Even after childbirth, the heart continues to be vulnerable to complications, a concern that can linger for years. But here's the good news. These risks can be managed. Regular checkups, a balanced diet, and moderate exercise can help keep the heart in good shape. Medication and specialized care may be required for those with pre-existing conditions. It's all about monitoring and managing these factors to ensure a safe pregnancy journey. A heart-healthy lifestyle can mitigate these risks. So, remember to look after your heart because it's not just about you anymore. It's about the little life growing inside you too. And finally, at number 1, the invisible struggle. Pregnancy is a time of immense change, not only physically but emotionally as well. It's important to recognize that issues can arise or become more severe during this period. Conditions like depression and anxiety can emerge or worsen, impacting both the mother and the baby's well-being. Postpartum depression, for instance, is a significant concern. It can affect the ability to care for her newborn and herself, casting a shadow over what should be a joyful time. It's vital to understand that these feelings are not a sign of weakness or failure. They are, in many cases, a natural response to the extraordinary changes happening in one's life. Remember, mental health is as important as physical health. Seek help when needed. So there you have it. The 10 reasons why pregnancy can be considered a dangerous time. Explored the unseen threats that can lurk beneath the surface of what is often perceived as a joyous journey. From high blood pressure conditions like preeclampsia to the risk of gestational diabetes. From the life-threatening ectopic pregnancies to the dangers of preterm labor. We've delved into the risks of heavy bleeding, infections, placenta previa, and the formation of deep vein clots. Even touched on the strain that pregnancy can put on the heart and the mental health challenges it can provoke. Yet it's crucial to remember that awareness is the first step towards prevention and management. With the right knowledge, support, and healthcare, these risks can be mitigated and complications can be effectively managed. While fraught with potential hazards, is also a journey filled with immense joy, love, and the miracle of life. Remember, while pregnancy carries risks, it also brings joy unparalleled. Proper care and vigilance, every mother can navigate this journey safely.